Hi, my name is Joseph Laughlin presenting for SeniorCom. SeniorCom is focused on helping you as seniors have the time that you need to do what matters most. You are at the prime giving time in your life. You've got so much that you can share with others. Every moment wasted is a great loss. Slide 2. Our mission is to improve the care that you receive in your home. What I mean by that is a little bit of a history about medical visits. It used to be, as you know, home visits were the norm. That's how it worked. Doctors would go to see patients who were in no state to be transported elsewhere. Then, with technology and other innovations, it was decided that it'd be better, perhaps, if patients came to the doctors and they started clinics and hospitals and that kind of thing. Now, with technology the way it is, verbal and visual, as well as instruments that can record acute pictures of various parts of the body, the inner ear, the eye, the throat, and other areas, we are able to bring a lot of healthcare to your home again, without the doctor having to travel to your home, to the home of each patient that he would like to see. Slide 3. And so what I'd like to present to you is a case study, and see if some of the things in this case study make sense to you, and see if some don't make sense to you. I'd like you to be very critical and analytical. On this slide you'll see a lot of details, and that's on purpose, because that's the truth of the story. That's how things are. What we're going to look at is Ruth, who is a recovering stroke victim. She has stabilized. The doctor has said that he would like to see her every week for the next 6 weeks, and if everything looks good at that point, then every month thereafter, until things really change. That's what he would like. That's his orders. And her family lives out of town. Her husband is deceased, and we'll go from there. What we see is she schedules her transportation with Oates. A home health visitor comes and helps her get to the doctor's office. They check in and wait for a few minutes, 20 minutes, 25 minutes, whatever the case may be, at that office, and then they're invited back to the examination room where vitals are taken, and then they wait while the physician finishes up with the next few patients in line, and the doctor comes and reviews Ruth's chart, sees that everything looks good, but he wants to talk to her and see that she feels things are going well, and he walks in and says, "Ruth, how are you? How have you been feeling?" Talks with her about what she's involved in, and just for a few minutes, and then says, "Ruth, have you been feeling fine? Have you felt anything that's out of the ordinary?" She says, "No, doctor, I do feel tired." And he says, "That's normal." And he says, "Ruth, I'd like to see you again next week as we had set up." She leaves the office, sets the next appointment, travels home with the home health aide on the Oates bus after waiting some time. It's not uncommon to wait, as you know, any of you who have used Oates transportation, to wait for an hour and a half, sometimes 2.5 hours. It all depends. And they arrive home. The home health aide goes to her next appointment. Ruth crashes on the bed exhausted. Now, how many of you have experienced this? This may be what you've experienced before, or may not. It may not describe your situation exactly, but I'm sure you know people who it does describe, and if you have had regular doctor's visits, you know what she's going through. And these are a lot of steps. Each one is necessary. You've got to get ready to go out. You've got to find transportation. You've got to have someone to accompany you, especially a recovering stroke victim. And all these things add up, and what it really ends up costing the biggest is your time. Time that you could spend contributing to the community, time that you should be spending with those closest to you. Slide 4. And so the cost for one routine visit, the total time very reasonably could be 4.5 hours, perhaps more, and in some cases less. And then the cost of the accompaniment by the home health aide, it's not unreasonable, $20 an hour. I know in some areas it's more, and in some it's a little less. But that's easily another $90. And so for a month of these routine visits, Ruth is paying $360 for her home health aide, she or the taxpayers, and it's costing her about 18 hours, 16 hours for travel, and then 2 hours at the doctor's office, the exam, and then waiting for the doctor, and then a few brief moments that they spend in exchange, which are very precious. Obviously, otherwise we wouldn't make this kind of an investment. Slide 5. I'd like to talk to you about another option. SeniorCom has developed a very simple platform on which a person's health information can be entered, vitals can be taken, a doctor can open up the patient's chart and view how she's doing, and make an initial determination, and then talk with the patient and see if his assumptions are correct. So let's plug Ruth into this scenario. So she's got these 6 weekly visits. They should be routine, maybe they won't, and that's why we have them. But the doctor needs to assess her because a lot can change in a week. And so the day of her appointment, Ruth wakes up and goes about her day as usual. At the time of the appointment, the home health aide arrives and says, "Ruth, how are you?" and comes in and takes her vital signs, enters those on the computer, and then notifies her physician that she's ready to be met with. And the doctor, after he completes his other appointment, whoever had been ahead of her, examines her chart, looks at her stats, and sees that she appears okay, but wants to talk to her face to face. And so he comes over the camera, just like I'm speaking to you now, and says, "Ruth, how are you? How are you feeling? How have things been?" And Ruth says, "You know, doctor, I feel relatively fine. I'm a little tired, but I know I've been through a lot." And the doctor says, "Yeah, that's normal to feel a little tired after something like this." And the doctor goes away, and Ruth says thank you and to the aide and goes about her day. Maybe this took half an hour, maybe. But let's look at what she saved. Slide 6. Excuse me. So what did she spend? 30 minutes and half an hour of her nursing aides, her home health aides time. In a month, it'll cost 2 hours of her time. Precious time, because we want her to receive the best care. And then the cost of a nurse aide coming, which would be, maybe they bill in hourly increments, and that'd be just $80. And then SeniorCom, just $60 for a month, of however many times you need to see the doctor. To me, that makes sense. To me, traveling for 16 hours and having 2 hours of visits does not make sense. And unless that's the only way it can be done, then it makes sense, because her health is valuable. So slide 7. Let's compare travel time of what we just mentioned, 16 hours and 2 hours of the visit. The cost of the nurse's aide, $360, someone's hard-earned money. And the cost of SeniorCom, just $60 for the access, no matter how many times you have to do it. no matter how many visits in a month. $80 for the nurse's aide because you've got 4 visits and just 2 hours of appointment time, if that. Now, wouldn't you like to spend the time with your family? Of course, who wouldn't? And so we're able to offer you this service. We've got a list of participating doctors, next slide, who see the benefits that this brings to you. This doesn't really change their schedule a lot, except they're able to be perhaps a little more efficient with the space in their office, but they're able to serve you in a manner so that's much more fitting to your situation and utilizes the technology that's proven and available today. So I'd invite you to thank them when they take the time to do this, that this really is a huge benefit to you. I'm grateful for the time I've been able to talk with you. My assistant has again, that list of physicians in the area. If your physician is not on that list, let us know and we'll talk to them and see whether this is a possibility for you. Again, thank you. I'm Joseph O'Loughlin with SeniorCom.